right, welcome to Facebook Live. This is Dr. Dan Purser, danpursermd.com. Good to see you all. Crazy weekend. What we've been doing nothing but a huge family party for 2 days now, it seems like. Is that right? Oh, Brecken, is that right?
Yeah, it's been a wedding. We've had a family wedding.
Huge wedding. Bailey married Justice. Justice works for me. He's a paramedic. He's a really nice young man, and Bailey's now an ICU nurse. And so there it is. They got married.
Dan finally got, or Dr. Purser finally got his endless cupcake buffet.
There was an endless cupcake buffet at the wedding.
But how many did you end up eating?
72.
Oh.
No, I'm kidding. I ate like 4.
They were mini, so.
I'm pretty sure I'm going into diabetes right now as we talk. Starting to shiver. It could be because I'm nervous about this very complicated Facebook Live we're doing tonight. So Brecken's across from me. Jackson's over there on the sofa, working his tail off as usual. Jackson does nothing but work now, and he's not allowed to have fun unless we let him have some fun. You had fun at the wedding, didn't you, Jackson?
Yes. You can't hear me, but yes.
Yeah, he said yes. His lips said yes. Okay, and also visiting here, he's visiting a little overly long now. Come over here, Jared. Quit being shy. This is Jared. He's in medical school at, what's that school called?
NSU.
NSU, down. Yeah, down in Florida.
Oh, sorry. Yeah.
Yeah, speaking to the mic. That's a problem I have too. Jared's flight got canceled. What was that?
Yeah, so I get one more day of fun with everyone else.
And so you came back to help me do my Facebook Live. So I'm going to ask, so you're getting ready for the post second year boards, the USMLE. Well, that's what we call them, 1, right?
Yeah, step 1 and then complex level 1.
Yeah, step 1 and complex level 1, whatever all that means now.
I don't even know.
Yeah, he doesn't even know either. They just tell you to take it, you run over and take it, right?
Pretty much.
So why would someone have a high reverse T3?
It's usually due to some type of infection or illness that's just not getting cleared.
Well, how did you know that? That's really cool.
Been studying for days.
And if you have a thyroid, someone on thyroid medication, what 2 tests would you make darn sure you check?
They're free T3 and free T4.
Free T3 and free T4, and they taught you that.
Yeah.
How dare they teach you something outside the norm? But they're really good guys at that school.
Oh, yeah, it's great.
They've all practiced pretty much and stuff like that, yeah. Mm-hmm. And nice people there. It's in Tampa?
Yeah, right outside Tampa in Clearwater. Best beaches around.
But you're moving over to nearer to Orlando because you're in a big clinic there for the next 2 years.
Yeah.
Pretty much the next year, and then off and on the 4th year?
Pretty much.
Okay, and then you're going to do your residency and then eventually come out here and save me from all these people, right?
Can't wait to
I don't know. We'll also be here for another 4 or 5 years after that, I'm sure.
Hopefully.
Just bugging you. Like a bad ghost that will go away. Okay, so
this
Will's...
is actually pretty funny. Heather and Dishnardi's in the comments, and she said, "Oh, hi, Jared. You guys have some strong-looking genes. Look at those similarities." It's just funny because they're not actually related by blood.
I'm not related at all.
Oh, we're still close, though.
But I feel like we all kind of look like Dan. It's kind of funny.
Mm.
It's funny. My grandson looks...
Oh, my gosh.
Thumbprint.
It is literally copy-paste. We call him Finny-Me because he's a mini Dr. Purser.
Finny-Me? Is that... Really?
Finny-Me because
he smiles like this and goes...
Yeah.
And he's 6 months old. He's like... He gets all excited. He's like having a seizure when he smiles. He's so cute.
He's excited little guy. He's
little
funny.
idiot. Yeah, he's a little cute little booger. And Will's running the show tonight.
Yeah.
Cousin Will.
I am indeed.
We figured you'd be married by now. And Will's a good-looking kid. If you want, no one wants to marry him, call. Okay. I'm teasing.
We'll be taking applications down in the comment section.
He's
He
ready.
will kill me for that later. Cousin Will. Okay, we're going to talk about really hard. So have you learned all about this stuff? Kind of not the way I teach it, but
Yeah, at least I've heard of it at least once. It's crazy. They teach us so many things, and they give like 5 minutes in a lecture to something that affects my entire life. Yeah.
And then when you kind of go into the area of medicine where you're seeing a lot of it, and you're especially the weird stuff I do with the root cause issues and look at vitamin panels and all that, which is just most doctors would think that's insane. And when my patients all laugh at them going, you kidding me? This stuff works. So, yeah. It's funny because most of these are related to vitamin deficiencies or genetic errors causing vitamin deficiencies.
Oh, yeah.
I'd say, except for the interstitial cystitis, that's just a whole other level of nightmare. So, okay, well, thanks, Jared. I'll let you go over there and take a nap.
Thank you.
I know you're tired from running around and dancing all night last night at the wedding. And I went home early. I did not dance the night away. So, my wife stayed because it was her party. She ran it.
Yeah, I was wondering where you went.
Oh, man, I went home with the bed.
You weren't there?
No, I've got bone on bone on my left knee. I'm going to, you know what I'm going to do next? I'm going to try stem cells, but that's another matter for another day. We'll discuss that some other time. Okay, so how's our crowd? We got 800?
Got 121 people watching.
Yeah, I'll
there,
take
so
what I can get
pretty.
here. This is going to be a little more complicated than usual. These are complex, awful, more severe problems we're dealing with, not your typical little aches and pains that we often deal with. So I'm going to start with interstitial cystitis. We're going to post this all at 7:30. And eventually we'll create a PDF and put it up somewhere or make it available.
Yeah.
Okay, good. So interstitial cystitis is awful. It's the most painful thing in the world. That's why we did the study with our gel. We did a double-blinded crossover placebo-controlled study.
Yep.
And with 30 patients because we wanted to create the proper p-value. And it was a third party doing it. So and we had really good results. We don't have the final details in yet, but the gel worked really well for it, didn't it?
Yeah.
So we'll find out more when we get the details out. And they're broken down. It's hard to do all the statistics on it. And we had a validated questionnaire we used every day and stuff like that. So let me get into this. I'm going to do these step by step so you know what to do. If you got pen and paper, take notes. But realize we're going to post this page after, probably at 7:30, I think. But also we'll do it as a PDF that's downloadable from danperserum.com, right? I don't know where we'll post it, but it'll be somewhere like that. So number one, with the interstitial cystitis, number one, you have to do a urine and vaginal DNA test for bacteria, fungus, yeast. I did not say culture. I said DNA test. This is level 2 Pcr testing. It's really advanced, but it finds everything. Everything sheds DNA. All those bacteria die, millions a day die, funguses die, yeast die, and they leave DNA floating around everywhere, which is really kind of creepy and horrible to think about. But that test will find them, and it does not miss, and it's very accurate. Also shows sensitivities and resistances. So interstitial cystitis, we know now, and you can go to PubMed and look at studies that, and I've been posting stuff all week about this, but we know that IC, most cases are probably caused by either a bacteria, a fungus, a yeast, or all three. And some, the ones that we can't figure out, are caused by viruses. I don't know for sure, but I think the people we use, Microgen DX out of Lubbock, Texas, that's the test result we use. They can do viral panels too. They can do viruses too. But we need to ask them, can we make that a note to call them tomorrow?
About what?
And see if they do viruses.
Yeah.
I know they do viruses, but can they do it off a swab?
Yeah.
That'd be interesting to see.
Note.
You need to do the level 2 PCR testing. It's not expensive. I think we do it through Microgen DX. We send you the kit. You swab and you collect your urine and send them off. It's around $400 and something for the total of the two tests, I believe, or close to it, a little over it. So you do a urine and vaginal DNA test for bacteria, fungus, and yeast using the level 2 PCR testing, and we do it through Microgen DX out of Lubbock, Texas. Number 2, you need to reduce the pain and inflammation because it is god-awful. It's horrible. These women are suffering. And I'll tell you that AO Biologics or Serum X, it absolutely won't treat the condition. It won't cure the condition, but it helps get rid of the pain and inflammation. It's dramatic what it can do. So, and think about it, getting rid of some of the pain down there. A lot of the pain and inflammation is crazy. So it is a FDA registered OTC that won't affect, it's a pain gel. You should rub it over your pelvis, over your lower abdomen. Won't affect your kidneys, liver, nor is it addictive. And it just works. When the women we've studied in here and I've Zoomed with and everything, it's crazy what it does.
Yeah.
So yeah, you need to try it. Here it is. Right here, you can order it at serumx.com.
It's still 20% off with the code launch.
Code launch. Yeah, thank you, Brecken. I forgot about that.
Just want to make sure.
Yeah. If you haven't tried it, try it. The women in that study loved it. So, and then you order the most potent probiotics available. You'll need them. I like Nature and Healthy Trinity. It's probably the best in the world. Get it from their website, not from Amazon.
Should you be taking the probiotics before or?
I don't think it hurts to start the day before, but so that PCR testing usually is back in 7 or 8 days. It's quick and it's very accurate and it's very thorough. It's frighteningly accurate, and we're going to find out what's hiding in there. You'll also you'll need to come out and see me if you're not in Utah. We'll wait until you're more stable because most of you can't even leave the house. I get that. But we'll need to arrange that. We'll set that up. We'll talk to you about, or you can get your doctor down there to prescribe the antibiotics. So, but once I prescribe me, I'll need to come out. I got to say that because I want to keep my license, right? So we'll make sure you come out. So whenever it hurts, that's back to the Serum X. Whenever it hurts, just apply a drop or two every 4 to 6 hours. Sorry, I'm flipping back on my list here. Nature and Healthy Trinity is the best. You do not order it from Amazon, order it from their website because you can get discount codes and it's about a week quicker getting to you. So once you do that PCR testing, order it. And they have a vaginal probiotic too that's really good. So does Garden of Life. Matter of fact, I'd probably order both of them. You're going to need them before you're done. Garden of Life, you can get that off Amazon and their vaginal probiotic too. So Garden of Life is probably the second best probiotic. And Life 9, load up on it. If you're young living, load up on it. Load up on Nature and Healthy Trinity. Load up on everything. Now I'm going to horrify you. I'm going to horrify you because once we get the PCR2 results back showing the resistance and sensitivities of the usually multiple bacteria and fungi yeast involved, then I'm going to prescribe antibiotics for you. And we need to talk about that when we get the results back. And it could take a long time, 10 to 30 days. You might have to take them to clear this up. Remember, you've had this for years. We need to make sure it is gone. And I give you refills in case it comes back or sneaks back. There's just no other way to do this. There's no magic way to do this. Just be glad we can probably a 90% chance we can resolve it completely and get rid of your pain and inflammation too. So, okay, endometriosis is next. There's endometriosis and there's bad endometriosis. Either way, you got to figure out why your progesterone production is so low because progesterone will help with the endometriosis dramatically. Some women have progesterone resistance, so 1 out of 200 women with endometriosis, Brecken, will have genetic causes. They'll have genetic lack of progesterone receptors on their endometrium.
Man.
On their uterus.
1 in 200, you said?
1 in 200, and that's about what I've got. I've got probably 11 women who take 15 of those RDTs a night.
Wow.
I know you take what, 1, maybe 2?
Yeah, max.
Yeah, that's my average patient takes those.
Yeah.
Because after your mom and I were married for a while, she's like, I have endometriosis. I'm like, what? And I want some of that progesterone. So I ordered it for her, and she said, it's magic.
Yeah.
It's funny because I told her, go up real slow on it. Go up once a week. And a few days later, it's like, how do you like that progesterone? I love it. She said, I'm sleeping like a baby. I love it. I'm like, you're taking 1 still, or have you moved up to 7? I'm taking 7. I'm like, oh. In 3 days, 4 days, you take, wow. I was kind of blown away. But she eventually is going to settle on 4 or 5.
Yeah.
Which is still a pretty high dose.
That is.
Yeah, most women take 1 or 2. But endometriosis women will take more. So, so then the next thing you're going to do, make sure I want to know so two things. One, we need to figure out why your progesterone levels are so low. So I want to start with the Cell Science System CMA, cellular micronutrient assay. It's an intracellular test that we do, like I said, over 100, and the redox part of it too. Like I said, 100 different intracellular vitamins, minerals, amino acids, and antioxidants. It's crazy good and accurate. It is a major game changer. It's SpectraCell cubed. Same technology, just much improved. And looks at intracellular data. So I want to see that. I want to see what your genetics are. So the quickest, cheapest way to find out what your methylation problems are, which is usually the cause of a lot of this, get the Foundation Methylation DNA kit from my office also. So you can order them both from danperserumd.com. Just go there and order them. And get it cooking.
Yeah. Turnaround time is super fast. Right now, we're like getting them in a week. Like usually.
The CMA?
Yeah.
Wow.
Yeah. So they're way faster than SpectraCell. So
okay, yeah, order them.
if you guys order it, book your appointment like as soon as you send the test in. That way you're not waiting a long time.
I still try and squeeze you in because I know you're suffering and I want to know, and especially if I see bad bacteria on this situation, it won't be bad bacteria, but bad vitamin deficiencies and interesting genetics, we'll get you in pretty quick. That can be a 30 or 45-minute follow-up visit. That's a lot of data.
It's 100 different nutrients that you're testing.
Yeah, and all those genetic errors. You know, we're not perfect. We're all born with a lot of stuff our ancestors gave us. Okay, then get on a big, consistent dose of natural progesterone. You'll probably need prescription, but you can also try Young Living's Progestins Plus or Designs for All Progestaval.
You've got them right there.
Yeah, oh yeah, here they are. And what's funny, because we actually make both these for, so yeah. So, and I designed them, helped design them, mostly designed them. So there they are. So, and try them. You can start with 1 drop of each. One, if you're a Young Living distributor or Young Living follower or know someone from Young Living, order the Progestins Plus. There's a reason why it's the top seller for them. And if not, you can always order the Progestaval if you can't find anyone from Young Living.
What about DNA genetic testing for?
Definitely, because that's probably the question here. Also get hang on, we'll get to that.
Okay.
Didn't I say that? Yeah, just wipe your cheeks. Yeah.
Oh, sorry.
Yeah, get the Foundation Methylation DNA kit. Yeah. Get my progesterone book. It's called Progesterone. It's been #1 3 times on Amazon. There's a reason it has been, because you want to read all about progesterone. And you also need to reduce the pain and inflammation that's been torturing you every month forever. Again, use AO Biologics Serum X. Go to serumx.com. That's that registered OTC pain gel. It will not cure it. It will not treat it, but it helps to get rid of the pain and inflammation really quickly, like in 15 minutes. Man, does it help the pain a lot. In the preclinical trials, the patients with bad endo loved it. And so get on the natural dose of progesterone. So take all your vitamins for your deficiencies and for your genetics errors. Those forever. The vitamins for 100 days, maybe some long term, just a few a week. And hopefully that'll help you make more progesterone naturally. You won't need to purchase so much. Okay. Severe PMS, kind of the same thing. You want to start with the Cell Science System cellular micronutrient assay, find out why you're not making enough progesterone, and also make sure you'll get a Foundation Methylation DNA kit so I can put the reasons as to why you have those vitamin deficiencies together. They go hand in hand. Your genetic errors that you're born with cause your vitamin deficiencies. Hey, didn't you see that, Brecken, on yours?
Yeah.
Yeah, didn't you see? Hasn't everyone seen that on theirs? Yeah, the DNA causes the genetic. Causes the vitamin deficiencies.
Definitely, yeah.
To a certain extent. Yeah.
Improperly functioning enzymes caused by different genetic deficiencies cause vitamin deficiencies.
You said a lot better than I did. So you should be a doctor really quick soon, hopefully.
This is Jackson, not Jared. I'm not going to be the doctor.
Jared, what say you? Yes?
Yes.
Okay, Jared said
I always
yes.
see like my B12 because that's one genetic area that I have a ton of the bad genetics there's for, and that's always what I'm deficient in. So it totally is true.
I keep finding typos in this thing I typed up. Sorry. Okay. Also get on the good consistent dose of Young Living Progestin Plus or Progestavel. It will help immensely with the inflammation and discomfort. And you can also get my progesterone book if you have severe PMS. You should get it. And also, you can definitely use the same thing, AO Biologics Serum X. Use it. Don't be afraid to use it. No reason to die suffering painful agony every month when you can take care of it so quickly and easily.
I just want to say there have been several comments in here already of Serum X, of people just using it and loving it. So it's cool. It's really fun to see that.
It's funny because I take that I've told you guys about that course we have to take to renew our state DEA license every 2 or 3 years. I think it's every 2 years, but maybe it's 3. Every time I read that, it's like there is no treatment for pain. There's nothing that'll get rid of pain, other than lidocaine shots or some kind of xylocaine shot or something, just to numb me up, and it's only temporary. But this stuff really helps get rid of pain.
It
really does.
Yeah.
I mean, it's quick. Within 10 or 15 minutes, you're feeling it. Usually faster than that, but we'll just say 15 minutes to be safe. Mm-hmm. And make sure you take all your vitamins. Same thing as for PID, pelvic inflammatory disease. This is just bad. It's like interstitial cystitis. It's just the vaginal version of interstitial cystitis of IC. Usually bacterial, but can be yeast or fungus or viral even, but usually it's yeast or fungus or bacterial. And you want to treat the pain with drops of Serum X as usual. Do a urine and vaginal DNA test for bacteria, fungus, yeast using level 2 PCR testing. That's number 1. Number 2, you need to reduce the pain and inflammation. You know what to do now. Use the Serum X. Number 3, order the most potent probiotics available. You're going to need them. Nature and Healthy Trinity, Life 9, and what's the one I like from the other one? I can't remember. Anyway, okay. The other probiotic I like. And use topical progesterone to also help inflammation. More is better. Rub it over your lower pelvis. Can really help. When the PCR testing comes back showing the resistance and sensitivities of the usual multiple bacteria and fungi yeast involved, take the antibiotics with food for however long it takes. There's just no other way to treat that. It's just your only option. You got to hit it with 3 or 4 different things and keep it at bay and make it go away. You don't need genetic testing for PID, for pelvic inflammatory disease. It's just bad. It's just miserable for you.
Yeah.
So, all that said, I know that was quick. Those are the big 4 nasties, and they're just really painful for you women. But you got really good options. Don't let doctors say, there's not much we can do, or your culture was negative, or this or that. Dig deeper, get the PCR level 2 testing, tell your doctor about it. If he won't do it, you know where you can get it done. Call us, 801-796-7667, or go to our website, danpersonmd.com. Are there any questions?
Yeah. Can you take progesterone if you have had a hysterectomy? Would you still need it?
That's a really common question. I'm not sure where it comes from, but I have a suspicion because I know a lot of doctors say that. For some reason, when your uterus is removed, they think you don't need progesterone. You're still a woman. You still need progesterone. It really works more for your breasts. I don't know why they say that even. I've never seen that in any research articles. It must be in a textbook of OBGYN somewhere that was written 50 years ago and still made it through all the changes as they update the book every year. It's just, no. You need progesterone no matter what. There it is.
Yeah. Let's see. trying to find questions. So if you guys have questions, feel free to leave them down below.
Someone was asking if the vitamin E, the tocopherols that are used in both of our progesterone serums, if they are soy or have soy.
No.
And our formulating partner, Stephen Pitcher, is in the comments answering for us as well. It's excellent.
Steve.
He's on there. They are
Hey,
not
Steve's
soy.
the genius, you guys. He's my partner on developing all these products. He helped develop Serum X. He helped develop Progesterone. He didn't really help with Progesterone.
The VARs, glutathione. is
Bars,
huge.
yeah. He's my partner on all this stuff. He's incredible. He worked for, we call him a rocket scientist. He worked for a company like Morton Thiokol. I always get it wrong, so I'm not going to try and say who it is. Developing, helping universities develop research projects for the space shuttle program. And then he got involved with Young Living, got interested in essential oils, stuff like that, and became head of production and head of research R&D. That's when I met him. So we've been friends ever since. He's a great guy. He was at the wedding yesterday. I'm surprised he's still alive after all the dancing and stuff. Was he out there dancing?
I saw him out there dancing.
What? No. Steve. I don't see that. So that's funny. Well, I wasn't out there dancing, so I'm not. There's no judgments here.
You were crawling out of there.
What was that?
You were crawling out of the
I
wedding.
did crawl out of there.
You've been using the Serum X on your knee, right?
Yeah, I do use it on my knee. It's really good. Yeah, I just got a limit on that knee. So after about 12 hours on it, I'm done.
Yeah.
And it's bone on bone, but it's not bad. I just went home and iced it and put more Serum X on it, and it was gone within 30 minutes. So the discomfort I had a suit on, so it's kind of hard to put Serum X on it all day.
He had
I
to
pull
walk
my
down
leg
the
up and do it.
aisle. He had to do all those things. So
Plus 4 family members hit me up for my bottles, so I feel sorry for people, so I gave my 4 bottles away.
that's
no
why you
little
brought
baggie.
them there.
I did kind of, but man, yeah.
What about fibroids? What would any of these things help fibroids?
Lots of progesterone. Years of not enough progesterone production causes fibroids.
Okay.
So you can take lots of progesterone. It will help shrink them 70% of the time. The other 30% it won't.
Gotcha.
And you just got to get them removed. The best way I like to get those removed, pay attention, it's called UAE, uterine artery embolization. Look it up. That's the best way. You don't have to have a hysterectomy. You just remove the fibroids.
Makes sense.
It's not a surgical procedure. It's a radiological procedure.
If someone's mom had hormone-positive breast cancer, should they be using hormones or should they be staying away?
Progesterone won't cause breast cancer. There's no studies that show that. Synthetic progestational agents will dramatically.
Yeah.
Natural progesterone, not a study. It kills breast cancer. It causes apoptosis. If you don't believe me, go to PubMed and look up 2 words, progesterone and the word apoptosis. And you'll see, I think it's 2,100 studies come out. It pops breast cancer.
Yeah.
Yeah, it doesn't cause it.
Apoptosis.
Yeah, there's no association, never been shown to cause it. Doctors try and say it, but you can't find the articles or whatever they're making up. It's crazy. Remember, I lecture about this all over the world, literally. Japan, Singapore, Australia, Europe, everywhere.
Should you take progesterone all the time or just certain days of your cycle?
I'm pro taking it all the time.
Yeah.
I'm not a cycler.
Yeah.
I've had some patients cycle, but rare. So and don't be afraid to use it. Progestin Plus gives you great value to use it, especially if you're a distributor. Progesterone is another option.
Yeah. Plus the great sleep, all those great benefits. Of
Yeah,
it.
it helps with sleep. That's probably the best thing most women notice about it.
Yeah.
I'm sleeping. Yeah, I'm like, yeah, yeah, you will.
Do you still need progesterone post-menopause?
Boy, I've got probably 2,000 patients that would say yes. Oh, absolutely, they'd say yes.
This one's like a little off topic, but if you're 10 plus years past menopause, what's the best thing to do for vaginal dryness?
Compounded testosterone cream. You try PD8020 from Young Living if you're Young Living, 2 or 3 a week. That'll bring up your testosterone level, but it usually won't treat the vaginal dryness. It sometimes does. It can definitely elevate your testosterone levels to a healthy range again, but it doesn't necessarily get rid of the vaginal dryness or the eye dryness or the mouth dryness. That's not Sjogren's syndrome. That's low testosterone postmenopausal. I know doctors like to say it looks like Sjogren's. Well, that sounds fancy, doesn't it? You're like, oh, I have Sjogren's. No, you're postmenopausal and you have low testosterone. It's like you don't have Raynaud's. Usually you have hypothyroid or hypothyroidism that's not properly treated is the real problem. It's not Raynaud's.
Yeah.
That's rare.
It is. And that's crazy.
So when we're going to do this coming up in about a week or 2 weeks, not next weekend, but 2 weeks, I'm going to go through my top 20 medical truths I've learned.
Ooh, interesting.
Yeah, I've already made the list up. It might be 25. I don't know.
It might be 30.
Probably be 84, but I don't know that. They go on for quite a while. So, okay, you got to try the Serum X. SerumX.com. You got to hit it. It can give you a lot of comfort in these areas. Even if you're using it 2 or 3 days a month, keep it in your fridge. There's 120 doses in that little bottle. It only takes a drop or two rubbed on. So there's 1 or 2 doses right there. And get it now while it's still on sale. Will never be cheaper. Trust me, it's going to go up in price. It's so expensive for us to make that. Grab it now and get on the subscription set too. Also, you can be an affiliate if you're a big believer in it. Affiliate.aobiologics.com, right? Mm-hmm. Sign up for that. Also, get some form of natural progesterone. Get the diagnoses. Figure this out. Figure out your root causes. Is it genetic? Is it vitamin deficiencies? And fix it.
Yep.
Quit goofing around with this stuff. So, and if your doctor just says there's not much you can do, I'm always skeptical when I hear that. Like it's magical that you have this problem. No, there's root causes that are causing it. So, root cause problems. Deal with them. Boy, I'm really on it tonight, aren't I?
You are.
I'm like, wow.
You're pumped
Mind
up.
me. I'm teasing. Do what you want. If you want to suffer, that's your choice. Okay. Sorry. Any other questions? Good questions. I know you're seeing them.
Does Serum X need to be refrigerated?
I don't know. I would. It's so expensive. I refrigerate my bottle. So you don't have to. There's no rule that says you have to. It's really stable.
I know. I slammed my finger in the door. Nasty pain. Hurt really bad. Jackson had a bottle from about a year ago, and we put it on, and I would say within 15 minutes, like, my pain was gone. And it didn't.
Does it come back?
No, it didn't bruise. And like underneath my nail bruise, and that's where the pain is, underneath my nail where I couldn't get any on.
I can pull some out needle and inject it through your nail.
But it really was shocking to me because I slam my fingers in the door all the time, and it's like weeks that it's in pain, and my finger's totally fine.
Yeah, we all know that pain.
I know. So it was just nice to have on hand for those kinds of weird little pains you get. But
I know my bone-on-bone pain in my knee. I've gone days sometimes when I didn't use it. That was a big mistake. I was dying.
I bet.
It hurts so bad. But I'm just going to keep it on there. I'm going to use it 4 or 5 times a day, a drop or 2 right on the sore spot. And it's been stable all day. That doesn't bother me.
Yeah, 2 other amazing use cases just this week was my mom and my sister. That we posted the videos of Denise, my mom, with her sunburn earlier this week.
Yeah,
and her
works really well for sunburn.
Her skin smoothing benefits, which were really, really fun to see as well. She loved it just as a cosmetic as well. It cleared up her burn very quickly.
Historically, sod in that gel has been used as a cosmetic.
Yeah.
For 50 plus years. Yeah, but they just haven't handled it correctly.
Yeah.
We'll leave it right there.
Yep, definitely. And then even Bailey, when she was taking her bridal photos like a week and a half ago,
the bug bites
got bug bites everywhere.
Oh, like
it's
60
crazy.
Bug bites
Crazy.
on her back.
We'll
on
have
her
to show you
face too.
pictures. It's
yeah,
insane.
We'll put together a little compilation of it, but it is amazing. And then she's been using Serum X on her face. Everything was cleared up by the time of her wedding. She was totally good to go.
She was glowing.
She's really allergic to bug bites.
Mm-hmm.
They were welts.
Oh yeah.
They're crusties.
Yeah, it is bad.
It's horrifying. I wouldn't have married her.
Wow. They're not even here anymore, though, at all.
Oh, yeah, they left for Hawaii.
They literally, I don't know.
The bugs or Bailey and
The
Justice?
bug bites, they were gone literally. Like, I still have them on my foot because I was trying not to put Serum X on it to compare, and my welts are still there.
Why don't you put Serum X on it?
Well, now I can. I just wanted to see the
Gonna
difference.
Being a knucklehead.
We can show pictures of that too.
Oh yeah, okay, do that.
You got to do an A/B test where
That's
you
an
don't
A/B
apply
test.
and you
don't
do apply.
use it and suffer like in agony.
Yeah,
Your
that's
foot
me.
swells up.
Yep.
That's why your foot looks like it's a balloon. Kinda.
Thank you. Thank you. The doctor's diagnosis.
It's a balloon.
It's a balloon.
That's why I paid for all that medical education. So, okay, well, we're just babbling on now. We love you all. Don't forget Serum X, Progestin Plus, Progestavel, PCR2 testing, and CMA testing, and genetic testing, foundation methylation kit. It's all pretty reasonable. Or get your doctor to do all that if they can. However we can help, we're here. We love you all, and we want to get you better. And these are four of the worst pelvic conditions I could think of. I didn't even think of the Serum X tie-in. I thought about it with IC testing, IC, but I didn't think about it. And then I realized that I was thinking all the women who've come in and used it for endo and stuff like that. They're like, this is a game changer. I'm like, yeah.
I do have one question.
Go ahead.
'Cause I meant to ask this earlier. There's been a couple people who said when they take progesterone, it can make them like not feel the feel good happy hormone, like feel happier. It makes them feel angry or sad or
Try it at a different time of the day.
Okay.
Try a smaller dose. Try a bigger dose. Yeah, it will happen on some women.
Okay.
It's rare. It's like 1 out of 300 or 400 will do that. Yeah, because remember I've got 2,000 that love it. Probably more than that, actually.
Yeah.
You talk about all the women who buy Progestins Plus. That's 25,000 every month at Young Living, I believe. It's a lot. So a huge number buy it through Designs for Health of Progestavel, and we manufacture that. We know the numbers.
Yeah.
So most women love it, but not everyone.
But
it's not for everyone. It's weird. Yeah, and some women it makes them nauseated like they're pregnant.
Or like headaches a little bit.
Yeah.
So it can cause a little bit of different things. You just have to kind of try different doses, different times. Or it might just not be for you. So
You might try an oral capsule like generic Prometrium.
yeah.
That's a natural progesterone made by Big Pharma, and you get the generic. Use a good RX card when you get it.
Yep.
Because it can really be cheap. Tried that, swallowing those. You got to get a prescription for it from your doc, but they'll probably go, yeah, I'll prescribe that. They won't quite understand what it is. Well, it's natural. If they knew, they probably wouldn't prescribe it. But then it's been around for 50 years. That's crazy that Prometrin's been around that long. Natural progesterone. Anyway, and then see if that doesn't nauseate. You'll know if you take one night.
Mm-hmm.
If it doesn't nauseate, you take that. It just might be the topical or the RDTs.
Yep. Makes sense.
Okay. Good question.
Yep. I just want to make sure we got that addressed.
Any others?
Can clary sage cause estrogen to read high? I thought that was an interesting one.
Yes.
Okay. So just be cautious with that when you're getting
I don't
tested.
know. Well, I don't.
Maybe.
Yeah, no, I've gotten over 700 labs on women who should not have any estradiol, and they have a good estradiol level using clary sage. Explain that. Yeah, I think it mimics estradiol so completely that the lab technology cannot tell the difference between it and it's been used for years to replace estrogens, but it will not cause breast cancer. It causes a 30% reduction in your rate of breast cancer. That's from a really good, well-done Iranian study, oddly enough, back before they got crazy over there. So yeah. Okay, well, good. That's a great question. Okay, I love you all. Call me if you need me, and let's see if we can help as many of you as we can. Love you much. God bless and go in good health.